I'm really excited to share the information that I've been invited back. And it's, I think, because I am a serial disruptor that also shows up with solutions. And that's what makes my seminars kind of fun, but also to the point. So I'm bringing two brand new organizations with me. Actually, they're not new organizations, but they're new to World Congress. The first is Lovelace Health Plan, who I believe has been so brave and courageous in launching one of the most complex, fully insured plans into their New Mexico market. Anxious to let you guys hear what they've done and the kind of results they're already getting. And the other one is organization and wellness leadership training. And I'm really excited to bring them because they've done some work with our military as well as with what we call transient workers, which I think is an interesting name for folks that actually work in the service business. Meaning food, people like at restaurants. And, you know, they tend to keep jobs, but then they move on. In healthcare, people have always said that we can't manage those people for better health. Well, actually, yes, we can, if we use the really important metrics of peer-to-peer counseling and short-term wins. So I'm excited to bring some very new information and give our employers, our health plans, our health systems, some new ways to conquer this incredible problem of healthcare costs and financial stability. Well, the biggest thing is the changing landscape of the ACA, what some people call Obamacare. Just today, we received new HHS rulings. How does that affect small business? What does it mean for the exchanges? And what we're seeing in the marketplace generally is that those who were ready to move as of last July have kind of skidded to a halt again. But we're also seeing some brave individuals, brave companies from all of the different market sectors step forward and say, nope, we're not going to wait. We have to get a hold of this health cost elephant, and it's time to get a hold of her right now. So I'm looking forward to bringing those folks into the room and having a very challenging, disruptive, and a little bit humorous, but most importantly, build some courage in that group. My first level goal is to get the employers and broker consultants into the room so that we can have an honest discussion about what do they need to do, what do they need to be thinking about, what are the implications of the ACA, and what are the implications of health information as well as health insurance exchanges. But I really want to see the medical directors. I want to see some of the community planners. I want to see some of the other innovators who will push back at some of the concepts that we're going to put on the table. It will be one hour of high charge, really interactive discussion. People who know me know that I do not like talking heads. We are going to move and we're going to get some problems on the table. For those people who are really interested in doing something different for themselves, for their companies, and primarily for their communities, this is the place to be. We're going to tell them small steps. I'm going to tell them about some of the new innovations that I'm working with and mentoring. I'm hoping to bring some new news of some companies that have actually joined in as a solution. Those are the kinds of best practices that the marketplace needs to hear about. Some of them will be there at the World Healthcare Congress. They always attract a spectacular array of folks. But some of them are real startups that are just getting out there and they're taking a really 90-degree changed view of the marketplace and how they're going to promote it. And I'm going to be there with them.